So good evening, everyone. With a small quote, I would like to start this Doctor's Heart Show. Your ears every sounds, your voice express every emotion, your breath powers every moment. So never ignore your ENT health. So good evening, everyone. A warm welcome to Dr. Zar on DC Live. So today we are truly honored to have with us Dr. Shivagama Sundari M, highly experienced ENT specialist with 14 years of expertise in treating ear, nose and throat condition. She completed her MBBS and MS in ENT from Sri Ramachandran Institute of Higher Education and Research and is currently practicing at Aishwarya Hospital and providing expert care for hearing loss, voice disorder and various ENT related health concerns. Doctor, thank you so much for joining us today and sharing your valuable time with us. Happy to welcome once again. And we also have the listeners from 4 centers who are listening to you via DC Live, ma'am. Thank you so much for your valuable time, ma'am. Yeah.
Thank you, madam. Thank you for such a nice intro. It's really nice to be addressing, the IT employees here. So ENT is one field where we deal with most common problems. In IT, usually ear problems, the most common problems which we deal with. And we are currently located in OMR. I'm working in Aishwarya Hospital OMR, which is an IT corridor. We have a lot of IT companies in and around. So we do see patients, IT patients day in and day out. So what I thought of doing is first I'll address the common problems in ENT and the basic myth, like the basic misconceptions which people have in ear, nose and throat. I will be dealing with each of it separately. So when it comes to the ear, okay, the most common thing in the ear which people come with is cleaning the ear with earbuds. That is the most common misconception. Madam, I clean my ear to remove the wax from the ear. So first thing is kindly don't use earbuds. Throw the earbuds at home. Okay, they are not going to cause any help. It is going to cause more damage to your ears. Firstly, why? Because your ear canal, there are small hair follicles. First, you have a ear canal, and then you have the eardrum inside. Eardrum helps with hearing, right? When your eardrum is damaged, you will not be able to hear. The moment you use earbuds, you either injure the ear canal, or if you go deeper down, there is a chance to injure the eardrum as well. If you injure the eardrum, it's going to be a permanent hole in the ear. So you'll not be able to hear properly, and that will require surgery in the long run. So first thing is kindly don't use earbuds to clean the ear. Minimal wax is good for your ear. Wax is secreted to protect your eardrum. So normally in the ear, it's a self-cleansing mechanism. Minimal amount of wax will come out every day on its own. It will just come out on its own. We need not do anything. All that we have to do is to keep the ear canal dry. So after a bath, you can take a cotton towel, wrap it around your fingers and just clean the ear canal with the cotton towel. That is more than enough. So that is the first myth which I would like to break. Earbuds are not going to cause any good to you. They will cause more harm to you. Okay. Yes. So next, second thing is ear pain. So whenever you have ear pain in your home, suddenly you have a ear pain, or you have a kid at home who has ear pain. So what people generally do is apply oil into the ear. Okay, or take a garlic clove and put it inside the ear. Ear pain will reduce. No, definitely a big no from the ENT surgeon's point of view. That again is going to cause harm. Okay, you put oil into the ear. Ear canal is a narrow space where there is no proper ventilation. So if you put oil, you're going to attract more bacteria and fungus into the ear. So we voluntarily are inviting the bacteria and fungus into the ear. So kindly don't do oil into the ear or garlic into the ear. No. If you have a ear pain, you can take a painkiller for the time being. But if it is long-standing, kindly visit an ENT doctor. Avoid water entry into the ear. That will help to some extent. But going to the pharmacy and buying over-the-counter drops and just putting drops for ear pain, a big no again. because there are different types of drops. Okay, for earwax, we have one particular drops. For fungal infection, we have antifungal drops. For bacterial infection, we have antibacterial drops. So there are different drops for different kinds of infections. The pharmacy person is not going to know what infection you are having. All that he'll know is you're just having ear pain. So whatever comes to him, he is going to pick it up and give it to you. That is going to, so for a fungal infection, you end up putting earwax drops, you're going to aggravate the condition, right? So a big no is self-counter, over-the-counter ear drops for ear infection. As well as for ear pain, strictly no to oil, garlic, and whatever home remedies your grandmothers, your parents have taught, a big no. Yes. Next, I recently had one patient who came to me. He told me that he used to wash his ear daily. While taking bath, he will flush water into the ear and wash the ear daily. That was again a very different thing, which I've never come across. That was the first time I heard somebody say that. See, washing the ear, why do we have to do that? As I already told, ear is a self-cleansing mechanism. God has created it such a way that he has given wax in the ear to entrap all the dust, and the wax is going to come out on its own. Just leave its course. Let the nature do its work. Why do we have to do all that? So please don't do the washing business into the ear. What you're going to do is, if you wash inside, the canal in the ear is going to get filled with water. Okay, water anywhere. Generally, where does fungus grow? Anywhere, wherever there's moist area, you see fungus growing, right? Similarly, the ear canal is a narrow space. Even one drop of water in the ear canal, which is retained, can attract fungus into the ear. That in turn will cause a most common condition, fungal infection in the ear. It's one of the most common conditions which we deal with day in and day out. It's called otomycosis in the ear. So this again is an infection which you are getting it by yourself by just washing the ear, putting water into the ear. No, a big no again. That is another myth which I wanted to break. A big no to washing the ear. Okay, next one, another major, common thing which we see in ear is insect entry into the ear. You are sleeping, suddenly something goes into the ear. Okay, that is another most common condition where I've seen patients come to me. So what you are supposed to do and what you're not supposed to do in that condition, I'll tell you. Okay, whenever an insect goes, people immediately pouring hot oil into the ear. No, a big no to that. Okay, so an insect into the ear, yes, it is going to cause lot of irritation in the ear. The insect will keep buzzing, will keep moving into the ear. That itself will cause a very severe irritation to you. Yes. So first home remedy which you can do at home is apply 2 to 3 drops of water. That is safe. Just 2 to 3 drops in that affected ear. For example, it has gone into your right ear. Put 2 to 3 drops of water into the right ear, turn to your right ear, tilt, and just wait for 2 to 3 minutes. Most commonly, what happens is, if it is a small ant in the ear, when you apply 2 drops of water, the ant is going to stay still. It's not going to move. That itself will give certain amount of relief to you. Turn to the affected side and wait for 5 to 10 minutes. Sometimes the ant or whatever insect, a small insect, will just come out on its own. Number 2. Then the next home remedy which you can do is flash light. You can use a light, put it in front of your ear, a light from your phone. Just keep it in front of the ear. For seeing the light, the insect will come out. Even after this, if the insect has not come out, immediately seek ENT doctor's help. Don't wait. It is a matter of 2 to 3 minutes for the doctor. We will flush warm water. We'll use a syringing technique. We'll flush the water, remove the insect. That is the next thing which you are supposed to do. Please don't keep the insect in the ear for 2 to 3 days. Wait, apply hot oil, do whatever home remedies, invite new infections, and then don't come to a doctor. Please seek help immediately. Okay. Then another main thing in here, coming to IT professionals, most common thing is a noise-induced hearing loss. We have seen hearing loss in different age groups. Generally, around 70 to 80 years of age, yes, you will get a hearing loss because the nerve which is supplying to the ear gets damaged. As you grow, the nerve capacity also reduces. But recently, we have seen even 30-year individual, 25, 30 years coming with a hard of hearing with a hearing loss. Why is this more common now? Because of prolonged use of headphones, earphones. What do these do? They directly attack, they will affect your inner ear hair cells. Okay, there is something called as hair cells in your inner ear. They are very delicate structures. When you expose those hair cells to loud sounds every day, day to day exposure to loud sounds can result in damage to those delicate structures. Once that is damaged, it's going to be a permanent damage. There is no, reverse. You cannot reverse the condition back. So recently, the government had released some guidelines for this. What they have told is rule of 60. Okay, every day the earphone usage should be only for 60 minutes. That is what the government has said. Even in that 60 minutes, they're asking you to take frequent breaks. 10 minutes, take some break, and then 10 minutes. That's how it is. And another 60 is the volume bar in the earphone which you're using. The volume should be less than 60%, the midline, right? It should be less than 60% of what you're hearing to avoid this direct damage to your inner ear. So if it is not possible, your workplace requires you to use the to use the earphones for prolonged times, then kindly take frequent breaks. Keep the volume under control, less than 60%. And my advice would be you can use the over-the-canal earphones rather than inside. Avoid the AirPods, earphones, whatever recent ones which you got, which you put inside the ear. Kindly avoid that. You can use the large over-the-ear ones, are better compared to the AirPods. And one more thing, if you feel that you're exposed to loud sounds in your workplace for prolonged time, kindly get the ears checked. At least yearly once, get an ENT checkup, check the tympanic membrane, and you can do a basic test called as the audiometry. What it does is, it tells us the amount of, it tells us your hearing capacity, okay, if you have any degree of hearing loss or no. Yearly checkup is definitely going to help you. So that is the most important thing which I wanted to tell. And one more thing, if in your workplace, if there is loud noise, for example, you're working in your printing press or whatever, and there's loud noise, you can use devices which ear plugs which can protect the ear. Rather than direct exposure to the ear, you can use safety devices to protect the ear. Health comes first. Okay, so if you are healthy only, you'll be able to do well in your workplace as well. So first, take time every yearly once, get your ears checked, do the audiometry, and once everything is okay, if it work. Then any other thing which I missed in here?
No, actually, I had the few questions what you were listed and we were explaining about the ears. The first one is what type of earbud we used. I think you're covered in that because people are without a earbud and without a phone, it's not working nowadays, and people are not ready to take the phone and keep it in the ears. So it wants something where automatically to be done, automatic call answering, automatic everything. So which will be the safety things? That was my first question I was supposed to ask you, but well in advance you answered to it. I think very simply it was covered how to be the basic care to be taken for the ears, ma'am. I think that's even for the kids you have covered, because nowadays we see the kids are using the bud. Recently even I've undergone with the same thing. My daughter has used the bud and she was like little scared to tell me that the bud got inside her hair. So it took 2 to 3 days and she got suffering from the pain and started bleeding overnight in the night 11 o'clock. Then when we went to the ENT doctor, they use that sucking machine, right? The machine, there we came to know that the bud went into the heart. Yes. It was like many incidents. Kids nowadays very energetic. They don't know what they're doing. But still, even though if they say it's a small pain, we should not take it. They are just giving us reason. Immediately the action should be taken care in the when we talk about it.
Yes, true. One more thing is ear pain sometimes will not be related to the ear itself. Okay, sometimes a throat pain also can radiate to the ear. Sometimes a dental pain, a tooth pain also can radiate to the ear. It is called referred pain. So any ear pain should not be left at that. It's always better to go get the help of the ENT doctor immediately. So, and your kid, luckily they've seen the ear, but within 2 to 3 days, you've gone and they were able to remove. Sometimes what happens is there are prolonged foreign bodies in the ear. Like they don't even know, they just forget the cotton inside. It stays there for months together. And that will create full pus and it will start eroding the surrounding structures, which is very, very complicated. So that's what my basic take-home message from here is: don't put anything into the ear. Let the nature do the business. Let us just keep it safe. Let us protect our delicate ears. So that is the main thing.
One more thing, ma'am. Now the technology has gone wise. Even though there is a camera, instant camera, ENT doctors are having in their hand. If they, the moment they come across with any major problem, they check what's wrong with the ears. They immediately every process went within a hour. I was like, oh, if all of a sudden it started bleeding here, what you will think? Something wrong in the brain. Our imagination goes beyond the level.
Yes. As a mother, I can understand totally. Yes.
It was around like 11:30. So when we were talking about those things, I was able to recollect those pictures. But still, ma'am, so this is like something which the common problem we're talking. When it comes to 60 plus elderly people, so what is a common problem they come across, or what are the steps we can taken, ma'am? Like
in the ear, is it?
Yes. And we also see that, listening capacity goes down when they are 50 plus and 60 plus. And we suggest to take them, go for the hearing machine or something like that. So what is your thought about that, ma'am?
So 60 plus, generally, as I already told, the nerve that supplies the inner ear generally weakens as time goes. As they age, the nerve weakens. So your inner ear slowly lose its potential. It will slowly reduce day by day. So the hearing capacity will reduce. But what I generally tell my patients is, if it is not affecting your day-to-day life, as in you're able to answer phone calls, you're able to hear a bell ringing, you're able to hear somebody calling you, then you're absolutely fit to go. You don't have to do anything more. Okay. Only when you can't hear the doorbell ringing, some alarming situations where you can't hear anything, that's when you need to get the hearing aids. Okay. Hearing aids, coming to that, that is a vast, there are different types, different brands of hearing aids available in the market right now. Okay, you just Google it up and you end up with n number of hearing aids. So first thing is, before you go to a hearing aid, okay, first see an ENT doctor, check the ears. If your ears have basic wax, sometimes the wax in the ear gets impacted. Okay, it gets impacted like a stone. It gets fully occluded into the ear. That itself could be the cause for your hearing loss. I have seen patients, you won't believe me, I've seen patients who have had hearing, who had impacted wax, but ended up going for hearing aid, doing the trial and coming back to me and telling me, I'd used hearing aids, still I'm not able to hear. Come on, there is wax in your ear which has to be removed first. So the first step into your diagnosis would be to meet an ENT specialist, get your ears checked. If there is wax in the ear, the doctor will remove the wax and then we will do the testing. And in that testing, if your hearing level is less than 60%, that is when we advise hearing aids. And you can choose the hearing aid based on your, the financial needs, based on whatever your need is. Some people don't even want to, want it to be seen outside. They want in the channel. Yes, cosmetic reasons. There are multiple factors which you can discuss with your audiologist and you can get it done.
So when we're talking about this, I just want to talk about the social media also. Now you see a lot of Instagram or everything where they show you how to clean your ear with wax. They keep some plate or something, they pour something like a candle or something like wax, it will melt and come out. And we never expected so much of wax in our ears.
Yes.
What's your thought on that?
Absolutely a big no. Okay. Instagram has both up and, downs in it. And I feel this video, even I myself have seen a lot of videos of that, which I highly say it's very, very, very bad. Please don't do all that. Okay. Here is very delicate. Why do we have damaged so much? Leave it. Let the nature do the work. Minimal wax will come out on its own. If there is a lot of wax, if there is ear block, kindly see the doctor. What we will do is, when there is a lot of impacted wax, which cannot be removed if it is too hard, we give a drops which will liquefy the wax. Okay, we give the drops for a minimum of 4 to 5 days. Once the wax gets liquefied, then we ask the patient to come back to us after 5 days and we remove the wax. So it requires at least 2 sittings, and this magic Instagram videos are not going to work out. They will rather rupture your eardrum. I recently had a patient who had ruptured her eardrum by using a machine which was supposed to remove the wax, and she ended up getting admitted under me for 2 to 3 days with IV antibiotics, and only then we discharged her. So please don't go by those videos. They are not going to cause any health to you.
Thank you, ma'am. So that's all about ears, ma'am. Next, moving forward from your side.
Okay, next, coming to the nose. Okay, nose, the most common thing which I encounter day in and day out is nasal bleeding from the nose. Okay, so bleeding from the nose, as soon as you see somebody bleeding from the nose, the first thing is everybody around them gets panic. Are you bleeding from the nose? No, it is a very common condition. Why do we have to panic? Okay, first, our nose, the front of the nose is richly supplied by blood vessels. Okay, the moment a child nose picks, okay, if they have nails and they start picking the crust in their nose, that itself can cause spontaneous bleed from the nose. So if you encounter a nasal bleed in your life, or if somebody in your house had a nasal bleed, the first step which you're supposed to do is pinch the nostril tightly. Just hold the nostril tightly for 5 to 10 minutes. And one more misconception which I want to break here is, what generally people do is they tend to go backward, lie down backward when there is a nasal bleed. A big no to this, because the blood will go backward into your throat and into your stomach. Okay, don't do that. Bend forward, pinch your nostril, open your mouth, and bend forward. Okay, that is the first aid which you're supposed to do. For 5 to 10 minutes, give a tight pressure to the nose. 90% of the nasal bleed will stop with that. Even after that, if it doesn't stop, you can just, an ice cube, you can take it and apply it on the side of the bleed. Wait for 5 to 10 minutes. The purpose of this ice cube is to help in vasoconstriction. It will constrict the blood vessels which are bleeding, and that will help. Even after that, if the bleeding is not subsiding, that's when you should immediately go and see an ENT doctor. There are multiple causes for a nasal bleed, but the most common cause is nose picking, which I already told you. Sometimes an accelerated hypertension in people who have high BP. Generally, suddenly when the BP shoots up, you forget to take your BP tablet 1 or 2 days, and suddenly the BP shoots up, they have spontaneous nose bleed. Sometimes for patients who are on blood thinners, like, cardiac patients who are taking blood thinners, like ecosprin, clopidogrel, these blood thinners, when they take, even a small nick in the nose can start bleeding profusely. So in such cases, just get the ENT doctor's help. As you rightly told me, we do have different techniques and technologies right now. We have an endoscopy, which can be done as an OPD procedure, hardly 5 to 10 minutes procedure, where we insert an endoscope into the nose and we can check up to the back of the nose full. It can go all the way to the back of the nose and check exactly from where it is bleeding, and immediate safety measures can be done with the endoscope itself. So do not ever hesitate to seek an ENT doctor's help whenever there is recurrent nasal bleed. Okay, that is the most common thing. Next, in nose, one more most common thing which we see is foreign bodies in the nose. Children, they'll be playing and suddenly they'll pop in something into their nose. Okay, sometimes they bring the children immediately, but sometimes I have removed a chocolate wrapper which was in the nose for 6 months. The parent was not aware, the child was not aware, had sought multiple pediatrician advice, and just cold they had diagnosed, and he was given repeated cold medications. And all of a sudden, one nice pediatrician just thought of getting an ENT surgeon's opinion, and that's when the patient ended up in my clinic. And just an examination in the nose showed a retained foreign body, a chocolate wrapper filled with pus around. Imagine 6 months the child had been breathing from one nostril, one side is fully blocked with the chocolate wrapper. So if there is a foreign body, what I would say, if the child has put something inside, the first thing as parents, do not panic. Okay. Second, if you panic, the child is going to also get panicked, right? Just act as if you're very calm. Do not try to remove the foreign body on your own. Whatever instrument you have at home, trying to dig the nose and removing it out, no. You will either push the foreign body deep inside, or you will irritate the child. The child is not going to show the nose again to the doctor when you come. So the moment you see something in your child's nose and you have a suspicion, go immediately to an ENT doctor, not to a general physician, not to a pediatrician. They are not going to remove it, right? Who is going to remove it? Your ENT surgeon. So go to the ENT surgeon immediately. If it is seen, if it is very anterior and seen, it can be removed within 2 minutes in the OPD itself. First attempt, I always tell this dialogue, first attempt is the best attempt when it comes to the foreign bodies. So give that first attempt to the ENT surgeon. They will do a good deal. Please don't try to remove it multiple times, poking, removing it, trying to remove it, bleeding from the nose, child getting irritable, and the moment they come to us, the child doesn't show the nose. The child is scared if we will also poke. So please don't do that. Do not panic. Get the child immediately to the ENT doctor. Don't make the child cry. The moment you say something, the child is going to cry and inhale it deeper. It's going to go deeper inside. And yes, foreign body nose is an absolute emergency in ENT. Okay, it has to be removed immediately. Sometimes what happens, a very small foreign bodies can slip away and go into the bronchus, into the lungs, and it can end up in serious damage. So please get the foreign body nose removed immediately. Sometimes you've not seen a foreign body in the your child putting anything, but sometimes there is one-sided nasal discharge. Generally, when you have a cold, there should be both sides nasal discharge, right? When there is a single-sided nasal discharge with foul smell to it, if there is some foul-smelling discharge only from one side, along with minimal blood stains, that is 99% that will be because of a retained foreign body. The child would not have told you before. You don't know that there is a foreign body. But what are the symptoms which you can pick up is unilateral, one-sided, foul-smelling nasal discharge along with blood. If you see that, don't even hesitate. Immediately go and see an ENT doctor. We can check under the endoscope. If it is there, that foreign body can be removed off immediately. So these are the two common things. One more thing in IT professionals, which I see commonly, is sinus. Everybody, around 10 people, if they come, 9 of them will say, ma'am, I have sinus. What do you mean by sinus? See, a normal cold cannot be termed as sinusitis. Okay, it is not sinus. Sinuses are empty spaces in your bones. Okay, ideally, when do you call yourself that you have sinusitis is when you have repeated headaches in the front of the head. Okay, the mornings when you wake up, every single day you have headache. You have a stuffiness here. You have an obstruction. You have a facial swelling. Your face is fully swollen when you wake up. You're not able to breathe. There is nasal block. That is when you can tell I have sinusitis. You cannot just say a normal common cold is sinus. Okay, so how do we diagnose sinuses? A basic diagnostic nasal endoscopy. As I told you, the endoscope will be inserted into the nose and we will check whether you really have the sinus, whether all the sinuses are blocked in the nose. And there is something called as the nasal septum. The center of our nose is called the nasal septum. It is made up of cartilage and bone. Okay. Most common thing is the nasal septum will be deviated. Nobody will have an absolutely straight septum. No. If you take 10 people, 8 of them will have a deviated septum. Okay. Either by birth it is deviated, or in childhood when you grow, you would have had a fall to your face, or sometimes while playing, a ball would have fallen on the face and there could be a break and the septum would have got deviated. Do all the nasal septum require surgery? No, absolutely no. Only when you have symptoms, as in you're lying down and you're having one-sided nose block. You don't have cold, you don't have anything. Just every single day when you lie down, you have a nasal block on one side, or you have one-sided headache, or if you have blood coming from only one side of the nose, then you please see an ENT doctor. We will do an endoscopy or a CT of your sinuses and the nose. That will tell us whether your nasal septum really requires surgery or no. Not all sinuses also require surgeries. There are sinusitis which can be managed with medical management itself. So hereafter, just don't go and bluntly say, I have sinus, I have sinus. No. You are going to observe for your symptoms. Do I have a headache in the front of the head? Do I have nasal block? Do I snore in the night? Do people near me tell me that I snore in the night? Do I have a facial sting when I wake up? When you have all these symptoms, that's when you should have a suspicion of sinusitis. And and staying in AC. Your workplace would be, your work environment, if it is full of AC, okay, but kindly avoid, if you're more prone for allergies, if you're more prone for the sinus headaches, avoid direct exposure to your head and face. That is the first important thing. And another thing is allergy. In India, allergies are very common. Okay, you take 10 people, 8 of us have allergic rhinitis. What do I mean by allergy? When you wake up, continuous sneezes in the morning, around 10 to 50 sneezes in the morning, watery discharge from the nose, itching of the eyes, watery discharge from the eyes. This is called allergic rhinitis. It is again a most common condition. People come and ask me, why did I get this? Why did you get this? Because your parents could have had it. It runs in families. Just like how sugar, pressure runs in families, even allergy can run in families. If your parents are more predisposed to allergies, you also might have it. So what you can do is, when it comes to allergies, there is no permanent cure for allergy. You can just control it. Okay, if you are known to, have all these symptoms like recurrent sneezing, watering of the nose, kindly wear a mask when you step out of the house. Make sure your fan is clean. The fan in which, the room in which you sleep, that room fan has to be clean every monthly once. The AC vent has to be clean 3 months once. And the bedsheet on which you sleep has to be changed every alternate days at least. All this will help you on the long run. When you see an ENT doctor, we do prescribe nasal sprays, tablets. Yes, they will help. But only that is not going to help. Your lifestyle modification along with the tablets only is going to give you a good health. So the first thing is sinusitis, allergic rhinitis. These two, you have to clearly know what symptoms you're dealing with and then come to the doctor. We will definitely be able to guide you. So in nose, I can think of only these. So if you have any
question, ma'am. So when you were talking about the sinus, right? So there are the two. I mean, sinus symptoms also like same thing. A normal cold is also same. So how do we find is there any difference we can find it out of it? So I could find it like it should be a headache when it is sinus. So what is your thing, ma'am? What is
duration matters here, madam. See, common cold maximum duration would be 3 to 5 days maximum, right? Sinusitis patients will end up having prolonged duration of the illness. Even after a cold is treated, they end up waking up with headache and facial puffiness. This can last for months to years also. Okay. Every single day they experience headache, and as the day goes towards the evening, they feel better. But mornings are very, very difficult for them. It's typically called as office headache. At office time, they end up having headache. Books itself term it as office headache. So the difference between common cold and sinus is the duration. If it is a prolonged duration, you're having it for more than 1 or 2 months, immediately seek the ENT doctor's help. Don't wait.
Well, there is also one more question from the listeners. Is that as a sinus is related to the weather condition, sinus infection?
No, sinusitis is not related to weather. Allergy, which I was talking about, yes, it is related to weather conditions. Allergy gets aggravated during monsoon seasons, during pollen season. Whenever there's a pollen dust, the patient ends up sneezing recurrently, like 20 to 30 sneezes per day in the morning. Sinus is not like that. Even during summers, you can end up having severe sinus. Why does the sinus occur first? Sinus is the empty space in your bones. Okay, when it gets trapped, when the fluid is not able to come out through the nose, there is a blockage. That is when the patients end up having headache. Okay, so that is not related to climatic changes. No.
Okay, last question for the nose, ma'am. So now we can see like snoring, right? So elderly used to listen, like only the elderly people will be having the snoring problem. But now this problem has become a common problem. So how to solve that? If you could give some tips.
Very good question. Actually, snoring is one of the most common conditions which we encounter in our day-to-day practice. Okay, when it comes to children, I will say, okay, less than 10 years of age, if your child is snoring, it is definitely an abnormal thing. Don't assume that the child is sleeping nicely. One common myth which I hear is the child is sleeping, child is in peace. No, a baby, generally a child should sleep peacefully without any snoring with their mouth closed. This is the most important thing. If you notice your child opening the mouth and sleeping, or snoring in the night, or day-to-day activities when the child is doing their homework or playing, they keep their mouth open. That is a major thing for you to think about and take the child to the doctor. Why? Because there is a structure called adenoid behind the nose. Okay, this adenoid generally gets enlarged, just like how the tonsil enlarges in children. Adenoid also enlarges in children. So when the child breathes, normally if there is a free airway, the air will just enter their nose and go to their windpipe and to the lungs. When there is a block in the nose, when the adenoid is big and the child is not able to breathe through the nose, what will the child do? Automatically breathe through their mouth. Keep their mouth open. So first thing, if your child is a mouth breather, if your child is snoring, take the child to the ENT doctor. A common X-ray can be done to see the adenoid. If the adenoid is big, that has to be timely removed for the child. Surgery has to be done and the adenoid has to be removed. If you don't do it on time, if you just prolong it, what happens is the child will end up having recurrent ear infections. Okay. This adenoid, it will go and press on the tube. There is a tube between the nose and the ear called the eustachian tube. Whenever you fly, during takeoff, landing, you have a block in the ear, That's because of this tube. The purpose of the tube is to ventilate your ear. So when this tube cannot ventilate the ear, what happens? There will be infection in the ear. The adenoid will go and press on the tube which is supposed to ventilate the ear, and the child will have recurrent ear infections. The child will become a chronic mouth opener. Okay, they will just keep their mouth opening. All the teeth will get crowded. The crowding of teeth is one main thing, and the child's facial features will change. The jaw will start protruding forward. A typical face called the adenoid facies is what we know. So that the child will start developing. That is an irreversible thing. So if you see the child snoring for a prolonged, during a cold, yes, it is acceptable. When a child has cold, yes, they will automatically snore and keep their mouth open, but that is going to be a short duration. If the child is doing it for months together, please do not hesitate. Take the child to an ENT doctor. Now, coming to snoring in adults and elderly people, as you rightly said, before and all, only old people used to snore. But now, even a 30-year-old comes to me saying, my wife is complaining that I'm snoring a lot in the night. Okay. So when you should worry about it is, you're lying down and suddenly you're not able to breathe. Okay, you're getting up, taking a deep breath, and then you're going back to bed. This snoring is disturbing you so much that you're not able to breathe in your sleep. When that happens, immediately you have to get an ENT doctor's help. Okay, first thing what we'll do is we'll do an endoscopy into the nose, endoscopy into the throat, also to check if there is any block in the nose or the throat. I told you that there is a deviated, the septum, right? Sometimes it can be deviated. Sometimes a deviated nasal septum itself can cause snoring. Sometimes a very common condition like a tonsillitis itself can cause snoring. So these common conditions will be ruled out first in such patients. If there is nothing, but still the patient is snoring, then we advise something called as a dynamic MRI. Okay, it is an MRI which is done when the patient sleeps. The patient is asked to come to the hospital in the night. After he sleeps, the MRI is done. What is the purpose of this MRI? Is to check the level of obstruction right from the nose up to your windpipe. It will clearly tell us where exactly there is obstruction. Why is the patient snoring? Okay, based on the level of obstruction, the treatment varies. But generally, what I tell my patients who come with me for snoring is first reduce your weight. That is the first thing which I tell. I don't ask them to go for any surgeries. First thing, I give them 3 months time. Okay, in the 3 months time, minimum of 5 kgs weight is what I will ask them to target at. Okay, a physical activity, reduce 5 kilos of weight, breathing exercise and yoga. That itself will arrest 80% of your snoring. Even after that, if you persistently have snoring, that's when I advise for surgical management. Till then, first option would be at least 9. That only will play an important role in snoring.
Great, ma'am.
So that's about the nose.
No, I never thought like related to the nose, we have to take care so much of things. Only the problem when arises, right, we'll go to the ENT doctor.
Yes.
That's what.
Yes.
So no more question related to the nose, ma'am. Yeah.
Yes. Okay. Coming to the throat. Okay. Throat, the most common thing which anybody in your life would have experienced, a fish bone getting stuck in your throat. When you're eating a fish meal, suddenly a fish bone is getting stuck in your throat. What do you do? What do people around you tell you? Take a big lump of rice and swallow it in. Eat a banana, gulp water. A big no is what I will say. Please don't do all that, okay? A fish bone which is stuck in the throat can be easily removed within 2 minutes in OPD. The moment you take a rice bowl and you flip it inside, banana, whatever you flip it inside, it is going to dislodge the bone and make it get stucker even more deeper. It will go and get stuck. Yes, that if it goes and gets stuck even more deeper, it cannot be removed in OPD. It might require anesthesia. In OP, you might have to remove it. So first thing is, you can eat a fish meal. I will not say don't eat a fish meal. You can eat a fish meal, but make sure be very, very careful when you eat a fish meal. Any small bone also can cause a lot. I have seen patients with 5 days, 6 days history of bone being there, scared to come to doctor, full foul smelling, and then in OP itself I've removed. So if you have a slight bit of doubt also, just come get it checked. With light itself, we can see. With the normal headlight, we'll be able to see. If we are not able to see with the headlight, we'll put an endoscopy into the throat. Endoscope in the sense, ENT endoscope is not an endoscope which goes up to the stomach. No. This is just a video laryngoscope up to the voice box. We will see it's a very minor procedure, non-invasive procedure done in OPD for hardly 5 to 10 minutes. We can easily check if there is a bone and it can be removed. So next time you get a foreign body into your throat, don't even hesitate. Immediately go to an ENT doctor. Don't do all that methods. And one more important thing is, don't poke the thing. Oh God, I've seen patients who come to me with, they try to, induce vomiting. They poke the throat with their fingers.
Use a brush to remove it. I don't know.
Yes. So all that if you do, what happens is you'll damage the mucosa in the throat, and that itself will take a lot of time to heal. It will take at least 1 to 2 weeks to heal. Rather, if you had come to an ENT doctor, just get it removed. There is nothing for it to heal, right? So don't hesitate the next time you get that. And one more common thing in throat is tonsillitis. Yeah. Anybody who comes with throat pain, they'll assume they have tonsil. Ma'am, and a tonsil irukku. Yaar sonnanga ungalku Google and ChatGPT is what is making everybody, assume a lot of things. So kindly, tonsil is not a normal throat pain. It's never tonsil. Tonsil is a condition where you're getting repeated throat infections. Monthly, once you're getting a throat infection, and that infection requires antibiotics to get cured. It's not like a regular throat pain which just comes and goes. Every time you get a throat pain, you're taking antibiotic and getting it cured. So monthly, once you're using antibiotics means, then it is indicative of a tonsillitis. Get it checked with the doctor. Tonsillitis is more common in children. As you grow old, the tonsil is supposed to shrink in size. But unfortunately, for some individuals, it doesn't shrink. It stays bigger. Those individuals are at risk of repeated infections. If those repeated infections happen, there is no point of taking repeated antibiotics. Monthly, once you take an antibiotic, you get resistant to that antibiotic. So next time when your body has a bigger problem, that particular antibiotic is not going to work for your tonsil, for any other infection. Yeah. So it's always better to get the tonsil removed. I will not say everybody who has big tonsil should get it removed. No. Everybody who has big tonsils, but whoever has symptoms, frequent symptoms, which is affecting their day-to-day activities, can definitely seek medical advice and get the tonsils removed. Okay. That is the next thing. And one last thing in the throat, most common is acidity, gastroesophageal reflux disease. So right now, none of us eat on time. None of us eat, home-cooked three meals a day. It's not always home-cooked meal, right? So all that happens because of our lifestyle changes. We are more prone to get acidity. So acidity, when you eat and sleep immediately, what happens is that your stomach secretes gastric enzymes and acid. When you sleep, all the muscles will relax. So between the food pipe and the stomach, there is a muscle. Okay, that muscle also relaxes. And what happens is all the acid from the stomach will come up to the throat and it will start irritating the throat. So what these acidity patients commonly have, what they have in their throat is, the complaint which they have is a foreign body sensation in the throat. Something is stuck in my throat is what they commonly come to us. Sometimes they say a typical heartburn. Sometimes the foreign body sensation, not able to swallow. And very rarely they do come to us with a voice change also. When that is the condition, we do an endoscopy. As I already told you, we do a basic video laryngoscopy in the OP to check the acidity, to check the structures, the vocal cord and the structures around it. And if you have acidity, we prescribe course of medications for about 2 weeks. Along with that, that alone is not going to help. Along with that, lifestyle modifications. That is the most important part. Okay, avoiding spicy, oily, tangy food is a big thing which you have to follow.
Kimchi is also becoming very famous. Kimchi food is also becoming very
spicy food. That has to be completely avoided. Tea, coffee has to be completely avoided. Take frequent meals. Take little meal, but make sure you take it on time. Don't skip the timing. And what I usually tell my patients and what I try to follow every day is have a very early dinner. Make sure your dinner is around 7 to 7:30. I know it is highly impossible, but please try to do that at least for 2 weeks. In long run, that is going to help you. By around 7:30, you finish your dinner and you can have plain water after that. That's it. And go to bed. You see the changes in your throat. The moment you wake up the next morning, you're not going to have that foreign body sensation, that burning sensation, all that will disappear. So whatever medicine, whatever tablet, syrup I give is just a supporting measure only. The main thing lies within you. You have to take these precautions and that is going to help in the long run. So throat, I think I've covered most. Is there anything else?
Only one question about the throat. There are people of loving to eat every time a cool drinks, right? Very cold one, or they want to have chilled water. Now this because of summer, the moment they want to drink is pana thanni kudala fridge they have to just drink cold water, cold or something like that. But frequently when we have a cold water or frequently continuously we're drinking a hot water or something, will get affected of throat like.
See, generally throat pain doesn't come because of cold water. It comes because of the viral and the bacterial infection in your throat. Okay. But if for a normal individual, it is okay. But if you are an individual who's more prone to get recurrent throat infections, you already have a tonsil. Doctor has told you that your tonsil is a little bit bigger. Or you are an individual who's more prone for allergies, repeated sneezing in the morning, then kindly avoid cold items is what I would say. I would not say everybody should avoid it. Whoever is more predisposed, more, infection rate is higher for whoever it is, then they should definitely avoid the cold items. Yes, people who have tonsillitis, keep away from cold items, junk, sugary items is what I say.
Okay. So no more questions from the throat side, ma'am. So I think we have covered everything. And Q&A also, the in between, you have given us the time, the way you have taken the question raised and people who chatted with me. I just clubbed those questions and I asked you because few questions were, though they asked, you covered it when you were explaining about the particular session itself. Okay. So I have few people also joined live. So any questions from the people who joined live? So I have Kapu, Virupuram, a team representing the whole center. If any questions with you, you can ask Sabita, Nishita, Veena, Vichita. Any question from your side, team?
Yeah, hi Srilekha, great
Hi
name.
Sabita. Hi.
Yeah, hi ma'am.
Ma'am. Hi.
Yes. Hello, hi.
Yeah, hi ma'am. Recently I have this sudden voice change, ma'am.
Okay.
So I want to know the reason, ma'am, or else I want to know the symptoms, ma'am.
Okay, see, sudden voice change, okay, if your voice change is more than 3 weeks duration, you should definitely get it checked, okay. Why? Because your vocal cords, there are two vocal cords in your body. The two vocal cords move together to produce sound. Sometimes if you are a person who uses the voice more, for example, if you are a singer by profession, like you sing or you do chants and slogans for prolonged periods, your vocal cord is put under friction and tension. Recurrent friction to the vocal cord can cause a common condition called vocal cord polyp. Okay, it is a very common condition. So anything in the vocal cord, first thing is an endoscope, which I already mentioned. A video laryngoscope is what we do in OPD to check your vocal cord. So if your voice change is more than 3 weeks, please get it checked with an ENT. Please do an endoscopy.
Yeah, ma'am, I checked, ma'am, because after that, what has happened means like the jaws are giving sound, ma'am, when I'm opening the jaws, opening
Okay.
my mouth.
Okay.
So because of that, we stopped that process actually.
Now, what did your ENT doctor say? What, did they do an endoscopy for you?
Yes, ma'am. He wants me to don't give much strain for the voice.
Yes.
And because the jaws, ma'am, when we open our mouth, after this endoscopy, I'm getting sound when I'm opening
When
my
you
mouth.
open the jaw, you have a click
Yeah.
sound there.
Yes, click sound. Yes, that sound.
So
because
see,
of
do you have the habit of clenching your teeth when you sleep, biting your teeth?
No, ma'am.
No. So avoid anything hard. Don't eat any hard substance. Avoid even a basic chapati, I would say. Please avoid for the next 2 weeks. This jaw, no, is the temporomandibular joint. That joint, around that, there are a lot of muscles in that joint, okay? Sometimes if you had bit anything hard or during an endoscope when your mouth was open too wide, okay? Sometimes the muscles around that joint can get spasm, can get weak. In such case, you have to give rest to that muscle for at least 2 weeks duration. Don't eat anything hard. Complete voice rest. Voice rest in the sense, I would say, keep a notebook and write. Please don't even talk. Give complete voice rest to your voice. Even by the sound of your voice, I can hear the breathiness, the hoarseness of your voice. So if there is nothing alarming in your endoscopy, if there is no swelling, no tumor, nothing in your endoscopy, need not worry. Give complete voice rest for 3 weeks. Do not eat anything hard. Make sure you have soft, solid diet. You can take a muscle relaxant. You can ask the doctor for a prescription for a muscle relaxant to help the muscles around your jaw to heal. Okay. Even after that, if you still have that click sound, then it's always better to get an X-ray done and check after 3 weeks.
Okay, ma'am. Okay.
After 3 weeks, if your voice also is the same, you can go and get a speech therapy done. Okay, there are centers which provide speech therapy.
Okay, ma'am.
So if your voice is not coming back to its normal tone, you can consider doing a speech therapy as well.
Okay, ma'am. Yeah, sure, ma'am. Thanks for the inputs. Thank you.
Thanks, Sabita. So really, there is a lots of changes in our voice, ma'am, because we are friends together for a long time. So I could feel like why she's asking that question. So like, thanks, Sabita, for raising that question. So any other question from others? Shrikant, Veena, Vivek? We are at the end of the session. If any question, you can ask her. No? Any comment from anybody? Okay.
Just one thing.
Yeah, Shri.
Doctor, this one, so from past couple of months, I'm continuously actually every 10 days getting this throat infection regularly.
Okay.
Medicine, if I take also, okay, it cures in 2 days.
Okay.
But even after regular goggling with salt water, hot water and other things, still it is keep on coming back from past 2 months actually.
Do you get a fever also, sir? Every time
No,
you get
nothing.
Only throat pain is
throat
there.
infection and sometimes cough will be there.
Okay. Do you take antibiotic every single time when you get the throat infection?
No. Sometimes I won't take medicine also. But I'm just worried why it is keep on coming back.
Okay. See, if there is recurrent throat infection, which you're very much worried about, it's always better to get an endoscopy done to check up to the voice box. Okay. When you see an ENT doctor, the basic thing which they do is they use a headlight and they will check your throat up to the uvula. Up to the uvula, and the tonsil is what we can see. Beyond that, we cannot see with the basic light, sir. So if the infection is recurrent, please get an endoscopy done. And in the endoscope, the most common finding will be acidity, which I already told you. So if that is the finding in your thing, they will prescribe you antacids and medications for at least 2 weeks. Acidity itself can cause repeated throat pain without any infection in the throat. Just acidity itself can cause a burning sensation and throat pain, recurrent throat pain can occur. So if it is persistent, just go to an ENT clinic and get an endoscopy done.
Okay. Thanks for that.
Yeah, thank you, Shri. Thank you so much. So
I did not aware of that. Gastric also will cause the
Yes.
Yeah.
That is the most common condition, sir. See, any throat infection should ideally require an antibiotic and then a cure. If you're getting this on and off throat complaints, then definitely 90% of chance for acidity only. But I can tell you confirmed diagnosis only after an endoscope. So please get an endoscopy done. Endoscopy is not an invasive thing which you generally they do for the stomach, right? It's not that. It's a basic ENT endoscopy which we do in the throat. Get it done so that your mind will be clear.
Sure.
Okay. So that's an end of the session, ma'am. Thank you so much. So I think we have covered all the parts and what was the session was about. So thank you so much, doctor, for the wonderful session. I think after listening to you, many of us stopped becoming a Google doctor for ENT problem. You shared very useful tips about the ears, nose, throat in a simple and interesting way, to be very frank. Very truly learned about the lot because we had in the mind ENT, okay, problem vanda pona podo. So not like in advance like something. But now the way of the lifestyle is very important that we have to be aware of everything. On behalf of entire DC Live team and all the listeners, thank you so much once again. And all our listeners, please take care of your ENT health because even a small throat pain suddenly become a serious during the office meeting online calls. So thank you everyone for joining Dr. Zahar on DC Live. Stay healthy, stay happy, keep listening to DC Live. Thank you, ma'am. Thank you. Wonderful. I think many of them shared as a comment like it was a very useful session. Though they didn't go with, any of the problem, but when the alarms, rings at 30 plus, we have kids and elderly people. With this basic information, I think they are a little bit aware and they got a very interesting session from you, ma'am.
Thank you, madam. Thank you so much.
Thank you, ma'am. Thank you. So thank you, Lokesh, for presenting us. Thank you so much.
Thank you, ma'am.
Thank you. Thank you. Yeah. Bye, ma'am.